Consuming fried foods, especially fried potatoes, is linked to an increased risk of anxiety and depression, according to a recent study published in the journal PNAS. The study analyzed data from 140,728 people and found that those consuming more than one serving of fried food per day had a 12% higher risk of anxiety and a 7% higher risk for depression. The study also found that acrylamide, a chemical produced during the frying process, played a role in the development of anxiety and depression in adult zebrafish. Pharma-2B's investigational combination therapy, P2B001, has shown similar efficacy to Mirapex in controlling symptoms of Parkinson's disease. However, patients treated with P2B001 were less likely to experience side effects such as sleepiness and orthostatic hypotension. The company is planning to apply for approval of P2B001 in the US this year, based on the data. A diabetes drug called Ozempic, which suppresses appetite, is becoming popular among celebrities as a magical weight loss regimen. However, doctors say that patients need to take a more comprehensive approach, including focusing on diet, nutrition, exercise, sleep, and stress management. While the drug is effective, it must be combined with a proper diet, as obesity is a chronic, relapsing disease. People who use psychedelic substances to self-treat their mental health report mild to moderate positive outcomes, according to a study published in the Journal of Psychopharmacology. However, individuals who self-treat with psychedelic substances reported more negative effects than those who use them in clinical settings. The risks involved in self-treatment appear to be greater compared to clinical trials of psychedelic substances, highlighting the need for increased education and harm reduction strategies. Researchers at Virginia Commonwealth University have identified DNA methylation markers in newborns that may indicate the risk of developing schizophrenia later in life. This discovery may allow early detection and intervention, reducing the impact of the disease on individuals, families, and communities. As summer approaches, health experts are warning about the dangers of excessive sun exposure and the risk of skin cancer. Experts recommend avoiding indoor tanning, keeping a healthy lifestyle, and practicing sun safety by using mineral sunscreens that have zinc oxide or titanium dioxide, or both, and avoiding sunscreens that contain oxybenzone, which has some health concerns. Experts also recommend getting regular screening if you're at a higher risk for skin cancer. Researchers from the University of Colorado Cancer Center have found that combining radiation and immunotherapy could be the key to eliminating pancreatic tumors while stopping the cancer from spreading. The findings give hope to those living with the deadly disease, as well as pave the way for future research into other treatments to increase survival odds. Engineers at MIT have developed a new nanoparticle sensor that could help detect cancer earlier, using a simple piece of paper and a urine sample. The test works by shedding short DNA sequences excreted in urine when the nanoparticles encounter a tumor. The test is affordable and easy to complete, making use of a strip of paper, much like an at-home COVID test. In experiments with mice, the sensors were able to detect the activity of 5 different enzymes expressed in tumors, and could accurately distinguish between different types of cancer. The team is now looking to develop the particles further for testing on humans. COVID deaths in California have seen a 65% drop over the past 3 months, with March recording one of the lowest death tolls since the pandemic began. The declining number of deaths has been attributed to a less virulent virus and a high immune population. However, COVID outbreaks are still a threat, and it is becoming harder to track how prevalent the virus is in the community as many structural protections disappear. Experts warn that COVID outbreaks,